My name is Dr. Nanyeenya Nicholus. I did my PhD training from Makerere University, College of Health Sciences. My study was about variant suppression, perceptions, and effectiveness of intensive adherence counseling among people living with HIV on treatment with low-level viremia in Uganda. In 2021, an estimated 17,000 people died because of HIV-related causes, and then another 54,000 people contracted HIV in the same year, implying that HIV is a big problem in this country, Uganda. And in the same year, an estimated 1.4 million people were living with HIV, of which 1.2 million people were on treatment. And normally when these people are on treatment, we expect them to have full viral suppression, whereby we don't have any detectable viruses in their blood. However, some of them, even when they are on treatment, they still exhibit what we call viremia, or low-level viremia. When we take off their blood to test for their viral load, we realize that they still have some virus in their blood, normally between 50 to 1,000 copies per ml, and that is what we refer to as low-level viremia. And research elsewhere in other countries indicated that people who have low-level viremia have increased chances of HIV drug resistance. They have increased chances of transmitting the virus and then treatment failure. However, in Uganda, we really lacked that information, and that was the main basis of my PhD, where we aimed to determine the association between people having low-level viremia and virulence suppression. And then we wanted to understand the perceptions, what people living with HIV in Uganda think about low-level viremia, and then what health workers think about it. And then we wanted to test an intervention that could help with low-level viremia, that is intensive adherence counseling. And we basically had three objectives. The first objective constituted the first sub-study, and this was a retrospective cohort study where we analyzed data from the National Viral Load Program, and our aim was to see whether people who have low-level viremia have increased chances of virulence suppression. And we compared these people with people who had a non-detectable viral load. We compared people who had a viral load between 50 to 999 copies to those who have a viral load below 50. And results from this study showed that actually people who have low-level viremia have 4.1 increased the risk of virulence suppression. And then results from that study also indicated that low-level viremia is associated with male sex, children, and then being on a second-line regimen. And then in the second study, which was basically a qualitative study, here we used the healthy belief model, and the results indicated that actually people living with HIV were not aware of low-level viremia, and they didn't know its implication. They thought that if you have a viral load between 50 to 99, you are safe and nothing can happen to you. And this was also similar with the findings in the health workers, who also thought that if someone has low-level viremia, it's not harmful to them, and these health workers could not offer any intervention as such. And then in the last objective, which was actually a clinical trial, we wanted to test the effectiveness of intensive adherence counseling in management of people with low-level viremia. And here we had the two arms, the intervention arm, where we offered intensive adherence counseling for 3 months. And then we had the control arm, where we used the standard of care, just doing the routine adherence counseling. And we realized that intensive adherence counseling almost increased, doubled the likelihood of achieving a non-detectable viral load, which would be like the recommendable viral load. And we're happy that these results have come out and have been able to impact our country. The threshold for virulence suppression in Uganda has been reduced from 1,000 to 400 and 200 copies per mil for DBS and plasma samples respectively. And then also intensive adherence counseling has been instituted as an intervention to manage low-level viremia in Uganda. And then these results have been shared widely with other sub-Saharan African countries, and they are guiding researches and interventions to manage low-level viremia across Africa. This research was conducted across all the 4 regions of Uganda. In the first objective, we used the National Viral Database, which comprised of people living with HIV from the entire country. And then in the second objective, we conducted in-depth interviews and key informant interviews across all the 4 geographic regions of Uganda. And that also applied to the clinical trial, where we had 8 study sites scattered across all the 4 regions of Uganda.